Good morning. It's January 14th, and this is your daily brief in science. Here's everything you need to know. A new warning from the American Cancer Society says sustained investment in cancer research is essential to keep progress moving, and threats to funding or reduced health insurance access could jeopardize future breakthroughs. Dr. William DeHart notes that as survival improves, the focus shifts to survivorship, addressing physical, emotional, and financial challenges, and he calls for more resources to support survivors, caregivers, and clinicians. The report highlights ongoing challenges for research funding and workforce cuts under the current administration, arguing that steady funding is crucial for continued improvements in survival. Rising cancer diagnoses are linked to expanded screening, environmental exposures, increasing obesity from ultra-processed foods, and higher alcohol use among women, with calls for more research to understand causes. Experts emphasize the need to understand causes to improve prevention and early detection amid rising cases driven by the same risk factors. The article is an excerpt from STAT, noting that the full story is behind STAT+. Lung, colorectal, and pancreatic cancers remain leading causes of cancer death, with obesity linked to rising rates of endometrial and pancreatic cancers. Lifestyle risk factors persist, with tobacco use as the leading cancer risk despite declines in smoking. Only about 18% of eligible people receive lung cancer screening, though estimates may overstate actual screening rates. Public health guidance continues to urge daily actions to reduce risk. Maintain a healthy weight, avoid smoking, stay active, eat well, and limit alcohol. Findings come from Central Cancer Registries and the National Center for Health Statistics. As reported in CA, a cancer journal for clinicians, Cancer Statistics 2026. The report is complemented by the consumer-focused Cancer Facts and Figures 2026, available on cancer.org. A colossal jet of newborn starlight stands out in the galaxy, with the HH80/81 outflow spanning 32 light-years as fast jets slam into slower gas to create glowing shock-excited filaments. NASA's Hubble Space Telescope captured IRAS 18162-2048's jet, turning HH80/81 into bright pink and green patches against the dark of space. This jet is notable because it is driven by a very massive young star, not a low-mass object, marking a rare case among observed Herbig-Hiller outflows. Hubble's Wide-Field Camera 3 delivered high sensitivity and resolution, revealing fine details, movements, and structural changes in the HH80/81 system. The data allow measurements of jet speeds exceeding 1,000 kilometers per second, the fastest outflow observed in both radio and optical wavelengths for a young stellar object. The image analysis shows rapid motions and evolving structure within the HH80/81 features, enabled by Hubble's capabilities. IRAS 18162-2048 is a protostar about 20 solar masses, powering the luminous HH80/81 pair and located in the L291 molecular cloud. The HH80/81 system lies roughly 5,500 light-years away in the Sagittarius constellation, providing a valuable view into how massive stars form and drive protostellar outflows. The driving source is IRAS 18162-2048, identified as the most massive protostar within the L291 molecular cloud. A new partnership expands autism care in the Philadelphia area as CHOP teams up with SOAR Autism Center to open the CHOP SOAR Autism Center network. The first center will be near CHOP Pediatric Primary Care in Newtown, Pennsylvania, with additional locations planned across CHOP's footprint. The collaboration will bring CHOP's research from the Center for Autism Research and the Lurie Autism Institute into clinical care to inform interventions. Therapists will coordinate with each child's medical team through CHOP Primary Care Networks or the CHOP Autism Integrated Care Program to ensure comprehensive, coordinated care. Staff will work across CHOP's network and SOAR's services to provide integrated medical and therapeutic support during early development. The goal is to extend coordinated care throughout CHOP's system and with other care providers to support children's early development. Enrollment information and inquiries are available at chop-soar.com and soarautismcenter.com, with media contacts listed for questions. Leadership from SOAR co-founder and CEO Ian Goldstein and CHOP's Nathan J. Blum emphasize expanding CHOP's reach, integrating research with clinical care, and elevating SOAR's mission through the partnership. The program places outpatient autism therapy teams in centers offering speech, occupational, and behavioral therapy for children up to age 6 under one roof with full and half-day options and a play-focused, evidence-based approach. Centers will provide integrated outpatient therapy services through age 6, starting near CHOP in Newtown, Pennsylvania, using a research-based, play-focused method to build communication, social, and cognitive skills. A new population-level analysis shows that universal RSV immunization during the 2024 to 2025 season markedly cut illness in infants when high coverage was reached, with a 42.7% drop in emergency department visits and a 46.5% drop in RSV-related hospitalizations for infants under 12 months, while older children did not see similar declines. The study found that maternal RSV vaccination combined with nirsevimab reduced medically attended RSV-associated acute respiratory illness and RSV-related hospitalizations in U.S. infants during the same season, with reductions about half versus seasons before introduction. In Spain, a primary study involving 12,492 eligible infants found that over 94% received nirsevimab, resulting in an 86% drop in RSV-related LRTY hospitalizations in 2023-24 and a 55% drop in 2024-25 compared with pre-implementation seasons. The CDC-led study, published online December 22, 2025 in JAMA Pediatrics and funded by the CDC, notes limitations including potential lack of national representativeness and observational causality constraints. A contemporaneous commentary states that protection was sustained across 2 consecutive RSV seasons, and through a shift from RSV-A to RSV-B, marking a major turning point for infants and healthcare systems. Experts emphasize the need for consistent early immunization coverage in newborn cohorts to maintain reductions in severe RSV disease burden each season. U.S. data identify prematurity as a significant risk factor, with preterm infants accounting for about 20% of RSV hospitalizations in children under 2 and facing longer stays and higher ICU and ventilation needs, underscoring ongoing importance of prevention products like nirsevimab for these infants. First-season outcomes showed declines in first-time hospitalizations for LRTI, acute bronchitis and bronchiolitis, and reductions in outpatient visits for wheezing, asthma, and bronchitis or bronchiolitis, while all-cause hospitalizations did not decline significantly in the second season. The study used population-based surveillance across 7 U.S. pediatric centers, covering more than 5,000 children under 2, with medically attended A1 to estimate the effectiveness of maternal vaccination in infants under 6 months, and nirsevimab in infants under 8 months as of October 2024. Nirsevimab demonstrated 77% effectiveness against medically attended RSV-ARY and 81% against RSV-associated hospitalization in the studied season, with peak protection in the first 30 days after administration and waning protection through 130 to 210 days, offering protection against both RSV-A and RSV-B. A new study from Penn State researchers unpacks lightning initiation inside thunderclouds with a precise, quantitative model. It ties strong electric fields, high-energy electrons, X-rays, and gamma rays into a photoelectric feedback loop that powers the early stages of a lightning discharge. The findings, published in JGR Atmospheres, point to practical gains in storm modeling and prediction, with implications for aviation safety, satellite operations, and monitoring of high-energy emissions from storms. The work derives from a global collaboration and is supported by the NSF, CNES, and the Institut Universitaire de France. Researchers validate the photoelectric feedback discharge model by recreating storm conditions and comparing them to satellite, ground-based, and high-altitude observations, including pre-lightning radiation and radio signals. They also apply the same framework to energetic cloud events, such as compact intercloud discharges, when conditions nearly reach lightning development. A key result connects terrestrial gamma-ray flashes to the onset of lightning, showing gamma-ray production can occur in regions that are optically dim or radio silent, effectively uniting TGFS and lightning under a single process. The study describes a runaway chain reaction inside clouds where electric fields accelerate electrons seeded by cosmic rays, producing X-rays that release more electrons via the photoelectric effect and amplify the cascade until lightning forms. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.